Okay, good afternoon, everyone. So we'll start today's lecture. Today's topic is Neuroradiologic Anatomy Part 4. So in today's lecture, we'll be covering the following topics: the radiologic anatomy of the cerebellum, some particular regions within the cranium, and then the cranial nerves. The cerebellum is a little bit more complicated than the cerebrum. We don't have to actually remember every single part of the cerebellum, just a little bit of an outline of what exactly exists in the cerebellum. So this is the vermis in the center, and then you have the hemispheres on both sides. The vermis has 10 components, and for every component within the vermis is a component within the cerebellum as well. So in the vermis, you have the lingula, the central lobule, the culmen, the declive, the folium, the tuber, the pyramis, and the uvula, followed by the nodule and the end. So all of these will similarly correspond to another structure within the cerebellum. Okay, so here you have the lingula, and along with that, you have a structure named as the vinculum, which now would be called the ala also. So, and then you have the central lobule, the wing of the central lobule, and along with the culmen, you have the anterior quadrangular lobule. The declive, you have the posterior quadrangular lobule. The folium, you have the superior semilunar lobule. With the tuber, you have the inferior semilunar lobule. And then behind, you have the gracile, the biventral lobule, which corresponds to the pyramis. Okay. And then after the uvula, you have the nodule, which corresponds to the flocculus. The important thing to remember is there are multiple fissures within the cerebellum. There's a primary fissure over here, which separates the culmen and the declive, and is also separating the anterior quadrangular lobule from the posterior quadrangular lobule. There's a horizontal fissure, which separates the folium and the tuber, which separates also the superior semilunar lobule and the inferior semilunar lobule. You also have a posterior lateral fissure, which separates the pyramis and the uvula, and also separates the biventral lobule from the flocculus. So three important fissures: the primary fissure, the horizontal fissure, and then the posterior lateral fissure. You also have a pre-pyramidal or a pre-biventral fissure, which is before the biventral lobule. So the three important ones are the primary fissure, the horizontal fissure, and the posterior lateral. So we can actually pick these up on imaging also. So we'll start off with the sagittal imaging of the cerebellum because it's a lot easier to pick up structures there. So on this T1 sagittal image of the posterior fossa, we have already identified a lot of these structures previously. So just to remember, we've got the brainstem, we've got the midbrain, we've got the mammillary bodies over here, we've got the pons, we've got the medulla. This here is the quadrigeminal plate. We have got the superior medullary velum over here, the fourth ventricle, the fourth ventricular outlet. Okay, so the entire cerebellum is located more or less around the fourth ventricle. So this superior medullary velum here, that's where the lingula actually lies. It lies on the superior medullary velum. Okay, so whatever structure lies there, that's the lingula. After which you get the other structures of the vermis, and then you get the culmen, and then you get the declive. And here, as you can see, is the primary fissure or the anterior superior fissure. So between the culmen and the declive, that is where you get your anterior superior fissure. Okay, and then here you've got the horizontal fissure, the pre-pyramidal fissure. Okay, so that's another fissure we talked about. Here, we can see the tonsil. So there are some structures that we can identify even in the posterior fossa on imaging. The same thing on T2. So as we know, T2 is not very good to identify anatomy in most cases. So you can see a lot of that anatomy are not very clear. But you can still make out the primary fissure and the horizontal fissure and the pre-pyramidal fissure to some extent. You can see a lot more clearly the fourth ventricle and all the CSF spaces surrounding it. Okay. So again, as we go on, we're going more and more laterally from the midline. So now you can clearly see this superior medullary velum and the lingula lying on top. Here's a central lobule. This is the culmen. The same primary fissure, declive. Then you have the posterior superior fissure, and then you have the horizontal fissure, the pyramidal fissure, and the posterior. The posterior inferior fissure, and then here you have the tonsil, and next to that you have the uvula. So a lot of these structures will not be very clear on imaging. It's just the basic ideas that you should be able to identify grossly what are the different structures which are present on imaging. So more or less, you should be able to pick up that this is a superior medullary velum. Next to the midline in the sagittal sections, you will get the tonsil. When you come to the midline, you're not really going to see the tonsil. So it's a very common mistake that we make, that we comment on the tonsils and the location in relation to the foramen magnum at the level of the midline. The tonsils do not lie in the midline. So you have to come to a paramedian section to really be able to pick out the tonsils. Okay, so again, here you can see the same structures on the T2 image, but as we can make out, there's not very clear what is the different anatomy on the T2 image. You can see the fourth ventricle and the fourth ventricular outlet. These T2 hypointense anomalies over here are nothing but flow voids when CSF is passing through the foramen magnum. As you go more and more laterally, the vermis will then finally start changing into the hemisphere itself. So as you come more laterally, the brainstem will shift then into the peduncle. So this is the middle cerebral peduncle. Okay, this is the white matter of the cerebellum, sorry. And then these are the different lobules of the cerebellar hemisphere. You get the ala of the central lobule, the quadrangular lobule, then here you've got the horizontal fissure. So above the horizontal fissure, you have the superior semilunar lobule, and then below that you have the inferior semilunar lobule, the gracile lobule, the prepyramidal fissure, and then here behind that you have the biventral lobule. So again, nothing to really memorize in this. You don't have to really know the names of the different lobules. We don't really even use those anymore. It's just that it can be picked up. The more important thing is that you can pick up these fissures, which can help you identify what are the different structures around it. A very commonly noted thing is that these nuclei that exist, you're not really going to be able to pick them up on T1 imaging. They're a lot more obviously seen on T2 weighted images, the deep nuclei. So here you can see this hypointense structure within the white matter is a dentate nucleus in T2 imaging. Okay, so as you go more and more laterally, you just get more and more of the cerebellar hemisphere with the different lobules which are present over here. Okay, and the fissures will become a lot more obvious, so more and more lateral that we go. As we can see, as the more and more lateral it goes from the midline, the horizontal fissure becomes more and more obvious. So in the last image over here, you can clearly make out the horizontal fissure. On coronal imaging with the cerebellum, it is important to really recognize what is the anatomy of the cerebellum. So cerebellum wraps around the brainstem, and then it has these lobules which wrap around the middle cerebellar peduncle. The superior part of the cerebellum, which is wrapping around the middle cerebellar peduncle, here is a quadrangular lobule. The part of the cerebellum which comes from below and wraps around the middle cerebellar peduncle is the flocculus. So you can make out both of these here in the coronal images. This is the tentorium over here, just separating the cerebellum and the cerebrum from each other. Below the tentorium, you're getting the quadrangular lobule wrapping around the superior surface of the middle cerebellar peduncle. And here is a flocculus at the inferior surface of the middle cerebellum. The same structures on T2 over here. So this is the quadrangular lobule, and here you have the flocculus. Okay, and this is the tentorium over here, which is a lot more obviously seen in T1 imaging. As we go more posteriorly, we can see a little bit more structures. The same quadrangular lobule. This is the simplex lobule over here. Okay, and this is the brainstem. The more and more posterior you go, the more and more structures you'll be able to pick up. Now you're able to see a few fissures which separate parts on the cerebellum. There's a horizontal fissure. Okay, and this here below now is not the flocculus, but it is a biventral lobule now. And here now you have the quadrangular lobule still continue. As you go more and more posteriorly, the other posterior lobules will start showing up. So you've got the horizontal fissure here, the primary superior fissure over here, the superior semilunar lobule and the inferior semilunar lobule, the gracile lobule, the biventral lobule, and the quadrangular lobule. When you come to the fourth ventricle, you'll be able to see two very important structures. That is the nodule over here, which is part of the vermis. And next to the nodule here, you have part of the cerebellum, that is a tonsil. Uvula is a part of the vermis again, located just below the nodule. Okay, so this is very easy to remember that the part between the tonsils will be the uvula over here. And this is the nodule. So again, the same structures, a little bit more posteriorly. This is the fourth ventricle. This is the nodule. It ends below in the uvula. And on either side of the uvula, we'll have the tonsils looking over here. A very important thing that we can pick up on this anatomy over here in T2 is that the tonsils at the superior surface end up in the dentate nucleus. So sometimes it's important to remember that we're dissecting the tonsillar space and the tonsillar system. Then the cerebellar structure right above it will be the dentate nucleus. Okay. As we come more and more posteriorly, we can see some more of the cerebellar lobule structures. Not really important to pick up the names of each one of these. Okay, over here you can see this T1 structure, which is completely T2 hypointense. So this is the transverse sinus. Okay. You clearly make out the horizontal fissure over here. This is the most prominent fissure of the cerebellum. Same thing on T2 imaging. This here, another T2 hypointense structure. So both the transverse sinuses are joining together. There is a torculum. This the same thing over here. Okay, so before we go to the axial imaging, just a quick brush up of the cerebellar structures and anatomy. You have the vermis with the 10 different components, and corresponding to each of these, you have a part of the hemisphere also. So you can pick up a lot of this even on axial imaging as well. So here we've got the ala of the central lobule. We've got the central lobule, the culmen, and the decline. So when you start from superiorly, it's important to remember the lingula lies a little bit more inferiorly. It's going to lie on the superior medullary vein. And then the cerebellum wraps around, comes a little bit more superiorly, and that's where it forms a central lobule. So the first structure you're encountering is the central lobule. Okay, and then you have the culmen, and then you have the declive, in between which you'll have the primary fissure over here. As you go down, the primary fissure becomes more obvious. You have the corresponding cerebellar lobules lying next to it also. As we come more and more inferiorly, you can see more and more structures. So central lobule, this is the pre-culmen fissure. This is the primary fissure between the culmen and the declive. As we come down, you can see more and more of the cerebellar white matter. This is the horizontal fissure over here. This is a superior primary fissure. Okay, around the horizontal fissure is where you get the superior semilunar lobule anteriorly and the inferior semilunar lobule posterior to the horizontal fissure. This T2 hypointense and T1 isointense structure is a transverse sinus here. Right, so just the important structures that you can pick up on posterior fossa imaging. Remember that you can pick up these fissures. You can pick up the transverse sinus. You can pick up the torcula. You can, if you wish to, even find out what are the different lobules of the vermis and the cerebellar hemisphere which are present. You can pick out the fourth ventricle, clearly. You can even make out that there's some raised structures over here on the pons. So this is the facial collicula, right? And apart from that, you should be able to pick out the cranial nerves. We'll separately discuss cranial nerves as we go on, so we'll be able to be quite clear with that. Right, so the same structures as we go more and more inferiorly. You can see, again, we've come back to the vermis, and laterally you've got the cerebellar hemispheres. At this level, which is the inferior level of the fourth ventricle, again, you have the important midline structure. You have the nodule, you have the uvula, and on either side of the uvula, you have the cerebellar tonsils. Right. So we already discussed a lot of this anatomy previously, but now we know that even with cerebellum, we are able to pick up some anatomy within the MRI imaging. Okay. So now moving on beyond the cerebellum, which, as I had said, is a little bit of a complicated structure, and we don't need to know it in detail, but just a few important points. We'll discuss a few important areas of the cranium, which we really need to know, particularly areas like the pituitary gland. So here, this is the region of the pituitary gland or T1 image. This is a plain T1 image without contrast. So as we can make out, this is the adenohypophysis and this is the neurohypophysis. Very important to remember that the neurohypophysis is very rich in protein, and that is why it is T1 hyperintense on plain imaging without contrast. Okay. Then below here, this T1 hypointense region, this entire region will be the sphenoid sinus because it is filled with air. Okay. And then you can make out this thin strand extending from the sella up till the hypothalamus. So that is the infundibulum over here. The infundibulum will connect to the hypothalamus at the tuber cinereum. There will be another T1 isointense structure which will run in front of the infundibulum, and that is the optic nerve and the optic chiasm. So these are the different structures you can definitely pick up on at the level of the pituitary gland or T1 imaging. Same thing on coronal imaging. Here, this is, imagine you've created a cut at this level. Okay, so in coronal imaging, it can be difficult to make out a lot of times what is the pituitary gland. Okay, so you have to imagine that you've made this cut. Okay, so a lot of the different structures of the pituitary are not going to be very obvious to you. A way to identify it is that you pick out the cavernous sinus. This is the cavernous ICA. Okay, and whatever is between the cavernous ICAs on both sides, that is your pituitary. Okay, since it is not T1 hyper, this is likely the adenohypophysis. Below this T2 hypointense region throughout is the sphenoid sinus. Okay, so this cavernous ICA is wrapping around, and again, then it is becoming the supracoroidal ICA over here. Okay, and then above that, here we've got the optic chiasm that we can make out. This, on the other hand, is T1 contrast imaging. So with T1 contrast imaging, we can make out that the entire pituitary gland lights up. Okay, so this T1 contrast imaging, the entire gland is bright now. Even on coronal images, you can make out that the cavernous sinus is going to be enhancing and the pituitary gland also enhancing. But the rest of the structures don't really enhance. Okay, now coming to the orbits. So these are T1 images without fat suppression. Okay, so we can make out the different structures that we can see on the orbit as we go from inferiorly to superiorly. Okay, so whatever is the bright tissue that you're seeing over here, that is the fat within the orbit. Again, these are images without fat suppression. So the fat will appear bright. Okay, even with all this bright appearing fat, you can make out the different structures within the orbit. Okay, so this is the globe. And then behind that, this is all the intracoronal fat. This here, since we're coming from inferior to superior, this is the first muscle that you see which is running anteriorly, the inferior. Okay, this here is the superior oblique fissure through whichever nerves will enter. This here is a lateral rectus. This is the medial palpebral ligament and the lateral palpebral. At the next level, become a little bit more superior. So now you can clearly make out the orbital part of the optic nerve over here. Okay, at that level, you can also see the medial rectus and the lateral rectus. This here is the lacrimal gland. So, all the fat that you're seeing outside the muscles will be the extracorporeal fat, and this is the intracorporeal. So, this can be helpful to identify that exactly where pathology might be lying. So, if you're seeing it within the intracorporeal fat, it will be lying within the corus. And if it is outside, if it's outside the muscles, it's within the extracorporeal fat, and it is outside the muscles and a little bit more easier to access. So, at the next level, as you come more superiorly, now the optic nerve has disappeared. Okay, and now you can just see the fat, and we haven't reached the superior rectus yet. So more superiorly you come, I can make out the superior rectus over here. This is a superior oblique, and as you can see, it is wrapping around its trochlear sling over here. This is the trochlear sling of the superior oblique. Superior oblique comes immediately and wraps around and enters into the globe over. This is the lacrimal gland, superior or rectus over here. A little bit more superiorly, you can make out the superior orbital vein. and the fat in the orbital. This air-filled region between both the orbits within the frontal sinus. These are T1 contrast images with fat suppression. So now, as you can see very clearly, whenever you see that the fat contents are not bright, it means that it is a fat suppressed image. Okay, even on T1 and T2, both images, the orbit contents should be bright because there's fat. If it is not bright, it means it is a fat suppressed image. Okay, but even on the fat suppressed images, the muscles will appear quite bright and hyper. So as you can see, this is the inferior rectus, where again starting from inferiorly, the muscles are quite bright and obvious. So this is the medial rectus, the lateral rectus, the globe. You can make out the lens also here, right here. This is the cavernous sinus, between which you have the pituitary gland lying over here. The more superiorly you come, you get the optic nerve and the muscles still clearly seen. Same thing, the superior rectus, the superior oblique, the trochlea of the superior oblique, at which it winds. Okay, so on coronal imaging, we're going to start from anteriorly and go posteriorly. So here, anteriorly at the level of the eyelid, you've got the medial palpebral ligament, and you can make out the lens also. As you go more posteriorly, things become a little bit more obvious. Here you've got the globe, and you can clearly make out the different muscles now. So this is the superior rectus, the medial rectus, the lateral rectus. This is the levator palpebral superioris lying above the superior rectus. This is superior oblique, and this is the inferior rectus. Okay, so if we come a little bit more posteriorly, now finally the globe has been crossed. You can make out the optic nerve now over here. Okay, so a lot of times people have some confusion as to how to pick out the optic nerve in these images. Okay, so remember, these are again without fat suppression because all the fat contents are bright on this. Okay, so the very obvious T2 hypointense structure that you see in between all the muscles, that is what the optic nerve is. Okay. So again, the muscles are obvious: superior rectus, medial rectus, superior oblique over here, inferior rectus, and lateral rectus. In between will be the optic nerve. Okay, as you go more posteriorly, again the optic nerve will continue to lie within the center of all the muscles. Because as we get closer to the orbital apex, this entire thing becomes more and more narrow. So here, you can still make out some muscles, the lateral rectus and the medial rectus, the inferior rectus, and the superior rectus over here. This is more posterior. We have crossed the orbital apex, and now the muscles have ended, and now you're going through the orbital apex into the optic canal. So this here is the anterior clinoid process, and this here is the superior orbital fissure. This here is the optic strut, which will be the medial boundary of the anterior clinoid process. So the optic nerve will be going right here, just below the anterior clinoid process, and just above the superior orbital. Okay. So again, this is the anterior clinoid process over here, superior orbital fissure over here, and the optic nerve will be in between the two over here. Okay, so this is the optic nerve exiting from the orbit, and once it does that, it will form the canalicular component over here. Okay, so once it exits through the canal, then it will form the cisternar component, which is lying in the suprasellar system. Okay, and then it will join together and form the optic chiasm over here. Okay, so just below the chiasm, you can see a slightly thin and T1 isointense structure. So that is the infundibulum over here. This is the pituitary gland. You can also make out the ICS, and this will be the A1, which will come to wrap around and lie on the superior surface of the optic chiasm over here to form the ACOM. Okay, so these are again the same coronal images, but now they are fat suppressed. So you can see that the fat is all hypointense. So same structures that we saw previously. Here are the globe with the different muscles around it. As you come more posteriorly, it becomes a little bit less obvious as to what is a nerve. But as we know that on the fat suppressed images or contrast enhanced, the muscles will be T1 hyperintense. So you can make these out clearly. The superior, the medial, the inferior, and the lateral recti over here. The optic nerve, on the other hand, will still be isointense itself and lie in the central wall. So you can make it out over here. On T2 imaging, these are again T2 fat suppressed images. So as you can see, the orbital fat is suppressed. On T2 imaging, the muscles are not as obvious as they are on T1 imaging. So this is a medial rectus, this is superior rectus, lateral rectus, inferior rectus, which as you can see is not very, very clear. But a very important structure that we should not miss is this CSF space around the optic. So this is the optic nerve sheath that we can clearly make out, which indicates where the optic nerve is. It's very easy to pick out the optic nerve on T2, much easier than it is on T1. It's not very easy to pick out the muscles on T2, but it is much easier to pick them out on T1. So as we go more posteriorly, this, as you know, this is the clinoid process. So once it crosses the clinoid, it forms the canalicular segment, and then once it crosses the optic canal, it will form the cisterna segment over here, and then joins together, it forms the optic chiasm. The ACS will lie on the superior surface of the optic chiasm, as we can see over here. Right, so this is a structure which I'm hoping that you'll be able to pick up. So this will identify a few nearby structures first. So this here is the midbrain. This here is the third ventricle. Okay, so let's mark this out. Okay, so this is the third ventricle. We've got the structure 1. We've got structure 2. And then here we've got structure 3. Okay, so if you can you try and pick out what these structures might be and leave a comment in the chat box. Let's start off with structure 1. What do you think structure 1 is? Okay, so this is third ventricle. The third ventricle anterior wall. So what would the structure be? Yeah, so the structure 1 is the optic chiasm. What do we think is structure number 2? Yeah, so structure number 2 is a tuber cinerarium. And what do we think is structure number 3? Okay, so this is the structure that we are actually here to discuss on this slide. It is the liliquist membrane. Okay, so the liliquist membrane is this thin structure that you can make out on this T2 hyper image. This is not a normal T2 image. This is most likely a cis3D or a fiesta sequence. So here you can make out this thin T2 isointense structure, which is running between the dorsum sella and the mammillary bodies over here. This is the liliquist membrane. The liliquist membrane has two important leaflets. It has a diencephalic leaflet and a mesencephalic leaflet. This is the diencephalic. If you look a little bit more posteriorly over here, there's another thin structure running back to the mesencephalon or the midbrain. So that is a mesencephalic leaflet. So, and they both arise from the dorsum sella. So you have the dorsum sella to mammillary body leaflet. So that is the diencephalic leaflet. And then you have a leaflet from the dorsum sella excuse me, to the midbrain. So that is a mesencephalic leaflet. So you could even pick this out on axial imaging here. This is the infundibulum. Excuse me. This here is a dorsum sella, the third cranial nerves. This will be the basilar over here. And this very thin structure running from the dorsum sella, probably trying to come to the mesencephalon, is the liliquist Excuse me. Same thing in our coronal imaging. This thin structure is the lyricus membrane. It's important to pick this up on especially a sagittal imaging when considering an ETV. So you can see if the membrane exists, what is the size of the membrane, is it quite thick, is it not very thick? So it can help you plan your ETV. Okay, so next we'll discuss another very important structure that has very special imaging dedicated to it. Okay. So this is the hippocampal formation. We have discussed the hippocampal formation at quite a bit of detail in the last lecture also. But this is imaging particularly in reference to the hippocampus. So whenever you are trying to particularly visualize the hippocampus, there's a separate plane of imaging which needs to be, which the images need to be reformatted in. So first we'll select the long axis of the hippocampus, and then to image the hippocampus, usually we use a coronal plane which is at right angles to this long axis of the hippocampus. So in this coronal plane, these are how the images will look. We're starting from anterior and then we'll move posteriorly. Always remember that the hippocampus is an intraventricular structure. Until you see the ventricle, do not ever think that the hippocampus already exists. Okay. So when we start from anterior and we go posterior, the first gray matter that you encounter, a big thick chunk of gray matter that you encounter will be the amygdala. So once you start from the temporal pole and you start going posteriorly, there'll be a large clump of gray matter. So the first thing is the amygdala. Right below the amygdala, the gyrus will be the parahippocampal gyrus. And right next to the parahippocampal gyrus, the most prominent circle on the temporal surface inferiorly is the collateral surface. Medially to the parahippocampal gyrus, you get the entorhinal cortex over there. So as you go more and more posteriorly, now you can finally make out that the ventricle has finally appeared. Once the ventricle appears, now you can start saying that, okay, the hippocampus exists. So here, this is the hippocampus. At the superior surface of the ventricular roof, anteriorly, you still get the amygdala. And below the hippocampus, you get the parahippocampal gyrus. Okay, so until the ventricle comes, we do not talk about the hippocampus then. Now the ventricle is here, so we can talk about the hippocampus. Above that, you have the amygdala, and then you have the parahippocampal gyrus below the hippocampus. The more and more posterior you go, the more and more obvious the hippocampus becomes, and your amygdala starts shrinking in size the more and more posteriorly that we go. Here, this is at the level of the hippocampal tail. So this here is the fornix arising from the hippocampus on both sides. Okay, and this is at the level of the atrium, finally you get the hippocampal tail. So this here, this gray matter structure at the ventricle will be the hippocampal tail. You can make out the hippocampal fornix over here. This here is the hippocampal fornix also. This is the fornixial columns on both sides. Okay, the same thing on T2 imaging. Again, let's remember that surface anatomy is not very clear on T2 imaging. So as you can make out over here, it's really not clear what is the amygdala, what is the parahippocampal gyrus. So T2 imaging for the purpose of anatomy is not a very good idea. Now that the ventricle is here, we can say that this is the hippocampus. But as you can see, the anatomy of the hippocampus is not clear on T2 imaging. So it's best not to comment on anatomic structures on T2 imaging. FLAIR or T1 imaging is the best. Right. So even our axial images, these axial images are taken along the long axis of the hippocampus. That is why it looks like this. Otherwise, you would not see the entire length of the hippocampus like this. Right? So we're coming from inferior to superior. So the first structure you'll see inferiorly, you will make out clearly the collateral sulcus over here. The anterior end of the collateral sulcus, which turns toward the uncus, is known as the rhinal sulcus. And behind the rhinal sulcus, you get the entorhinal cortex over here. Okay, so as you come more superiorly, you encounter the hippocampus. So this is the hippocampus over here. This here is the subiculum, which is located just at the inferior surface of the hippocampus. As you come more superiorly, this is the hippocampal head, is the hippocampal body, and this is the hippocampal tail. More superiorly, now you can make out the hippocampal head and how it connects with the amygdala over here. A little bit more superior, the hippocampus has disappeared. The amygdala becomes a lot more obvious. The amygdala actually lies within the uncus over here. Okay, and now you can see this fornicel column arising from the tail of the hippocampus on both sides. Same thing on T2 weighted images. This is again just to highlight that these structures are really not obvious on T2. So it's very difficult to look for them on T2. Best not to try that. But again, a few things are obvious. The sulci and the fissures will be obvious. This is the head of the hippocampus that you can make out, very difficult to see from the surrounding structures on T2 weighted imaging. This is the head, this is the body, this is the tail. This here is the fornicel column. So as you can see, compared to what we were seeing on T1, this is really not clear on T2. Okay, so this is a sagittal imaging on the other hand. So this here, we're going from the midline laterally. So as you come to the midline, you're not really going to see any structures of the hippocampus, but you can make out a little bit of the uncus towards the medial end. As you come more laterally, you will first start seeing the amygdala. As we know that the amygdala is a part of the uncus, that's the uncus will lead into the amygdala. And just below the amygdala, within the ventricle, connected to each other, you have the hippocampus. Always remember, the hippocampus and the amygdala are connected to each other. Okay, so they lead into each other. Just the hippocampus is lying within the ventricle, and the amygdala is lying above the ventricle. The amygdala lies within the uncus. This structure below the hippocampus here is the parahippocampal gyrus. The slightly T1 hyperintense structure will be your fornix. The same thing on T2 weighted imaging again. Not clear as whatever we were seeing in T1 weighted imaging. Still can be mirrored a little bit. Here it is a lot more clear because this is the ventricle. Within the ventricle, you can make out that there is a clear-cut structure over here. So this is the hippocampus. But without that, it would really not be obvious to be able to pick up the hippocampus. If you choose a particular plane of imaging, you can even see the entire length of the fornix. Okay, so on this is the plane of imaging which was chosen to pick up the fornix. So that has to be actually chosen manually by the radiographer at the time of imaging itself. This here, you can see this entire T1 hyperintense structure shows almost the entire length of the fornix. So this is the hippocampal head, body, and tail. And you can see the fornix extending all the way around the thalamus up till here. Okay. This here demonstrates the hippocampal tails because again, this is the atrium. So at the level of the atrium, the part of the hippocampus which exists is the hippocampal tail. At the level of the hippocampal tail, the fornix of both sides will connect to each other through the hippocampal commissure. That is something you can make out here, which lies just below the splenium. So the splenium, you have the hippocampal commissure connecting both the sides of the fornix. Same thing even on axial imaging. So here you have the level of the atrium, you have the splenium, and below the splenium you have the hippocampal commissure connecting both fornices. Okay. Now another important structure that we can pick up on imaging is the insula. Insula is really easy to pick up. So we're going here from lateral to medial. The more lateral you are, first thing you'll pick up is the cerebellum fissure. You have the frontal lobe above that. We've already discussed the different parts of the frontal lobe previously. So once you go a little bit more medially, you start seeing the different insula structures within the cerebellum fissure. So you have the short gyri, the anterior, the middle, and the posterior short gyri, and then you have the long gyri. As you go more medially, you can make out the clear structure of the insula. This is the circular sulcus wrapping all around the insula. You have the anterior, middle, and posterior short gyri, and then you have the anterior and the posterior long gyri. This structure over here is the Heschel's gyrus, coming out from the temporal lobe. Yeah. Okay. Another important structure on imaging we will have to at some point maybe recognize is a subthalamic nucleus, important for DBS. Right? So the subthalamic nucleus, to pick out the subthalamic nucleus, the plane of imaging we use is the intercommissural plane. This is between the anterior and the posterior commissure here. And at 90 degrees to that, you take the coronal plane of imaging. So at the level of the red nucleus, you can look for the subthalamic nucleus. So this here is the red nucleus. This linear structure below the red nucleus at this level is the substantial nigra. Now, if you come a little bit more anteriorly, you will be able to see the subthalamic nucleus, which is the structure between the red nucleus and the substantial nigra. So this here is a red nucleus. This here is a substantial nigra. And in between them, what you're seeing is a subthalamic nucleus, right? So red nucleus, substantial nigra, subthalamic nucleus over here. Okay, so same thing. Substantial nigra, subthalamic nucleus. Another anatomic structure you encounter sometime during reading is known as the fields of Forel. So it's important to remember that it is just in this region. It is right above the subthalamic nucleus, below the thalamus. You have the fields of Forel right here. Another important region when it comes to talking about stimulation and DBS. Okay, so you can see it on axial imaging also. So here you've got the red nucleus lying within the brainstem or the mesencephalon over here. And the subthalamic nucleus over here, just below the thalamus. Same thing on sagittal imaging as we had already seen last time. As you can see, T2 weighted imaging, it is a lot more clear than it is in T1. So the deep nuclei become a little bit more obvious on T2 imaging than they do on T1 imaging. They're a little bit hypo-intense, so you can make out this is the substantial nigra, and this is a subthalamic nucleus over here. Not as clear on T1 weighted images. Okay, so another important area is the subcallosal region. So below the callosum, you have a few important structures. So first of all, it's important to know what are the different areas of the corpus callosum. This is the corpus callosum body. The anterior turn over here is the genu. And then below the genu, whatever is the corpus callosum is the rostrum. There is a gyrus just below the corpus callosum, known as the subcallosal gyrus, or the subcallosal area over here. Just behind the subcallosal area, you get a very thin gyrus that is known as a paraterminal gyrus. That is right here. You can make out over here. This is the rostrum, subcallosal area, and then you have the paraterminal gyrus over here. It's called paraterminal gyrus because it's just in front of the lamina terminalis over here, a little bit more posteriorly. Okay. So that finishes off for certain areas within the cranium which are important. We'll discuss the cranial nerves for the last section of this lecture. So this image here demonstrates all the cranial nerves that you can see, and it really helps you figure out as to where this will be located when it comes to imaging anatomy. So here this is a cut section through the skull, cut sagittally. So here this is the sphenoid sinus over here. This is the clivus, so that should help you get oriented. This is the dura covering the clivus over here. Over here you can see olfactory nerve along the ACM base. Above the pituitary gland you can see the cranial nerve 2 or optic. Next to the pituitary gland the cavernous sinus. So in the cavernous sinus, entering the cavernous sinus posteriorly, is cranial nerve 3 or oculomotor. Running just below the tent is cranial nerve 4 or trochlear. This is the petrous bone, and crossing above the petrous apex and entering the Meckel's cave over here is trigeminal. Lateral And inferior to the Meckel's cave, you have the internal acoustic canal, which will have the entry of CN7 and 8. Medial and inferior to the trigeminal porus would be your Dorello's canal. So this is 6th entering in the Dorello's canal over here. And below the IAC, you'll have the jugular foramen, through which 9 and 10 will enter. And 10 will exit from the brainstem and enter directly, while 11 will ascend from the spinal cord and enter the jugular foramen. A little bit more medially entering to the hypoglossal canal here, and lying a little bit more inferiorly will be hypoglossal nerve. Right, so we can identify all of these structures even on imaging as well. So as we know, the cranial nerves 5, 6, 7, 8, 9, 10, 11, 12 will be seen in the posterior fossa. The rest we can identify in supratentorial region. So here on axial imaging, T2-weighted imaging, you can make out the olfactory nerves over here. And it is very clear from the CSF space around them, this is the olfactory cistern. You can also make out the optic nerve over here on both sides. This is the canalicular segment of the optic nerve. Posteriorly, if we see, we can also even make out the third nerve. The third nerve is going to run from the midbrain and try to enter the cavernous sinus on both sides. Always the third nerve is going to lie lateral to PCOM. If it is a fetal PCA, the PCOM actually might end up lying lateral to the third. Right. So on this coronal images, if you look for the olfactory nerve, it will lie below the gyrus rectus. And again, will be surrounded by CSF on both sides. On sagittal imaging, also it is possible to make out the olfactory nerve. You get a T2, a hyper T2 image. Okay, so this is the olfactory bulb and the olfactory tract lying below the gyrus rectus within the CSF space over here. You can even make out the optic nerve over here and the third cranial nerve running between the midbrain and the cavernous sinus. So this is the optic nerve. If you particularly want to see the optic nerve throughout its entire length, you can find a particular plane of axial imaging which can image the entire optic nerve, chiasm and optic tract. So as you can see, this is normally not something you would see in standard routine imaging. Okay, but if you wish to evaluate the entire optic pathway, you can take axial imaging along the optic nerve and see the entire length. This is the optic nerve, the orbital segment. This is the canalicular segment. This is the cisternal segment. Then you have the chiasm, and then you have the optic tract on both sides. The optic tracts, it's important to remember, wrap around the floor of the third ventricle. So on both sides, you have the hypothalamus over here. Same thing. Cisternal segments, chiasm, and optic tracts. In between the optic tracts, you have the hypothalamus over here. The optic tracts, as we had discussed last time also, are a little bit T1 hyperintense. So you can make them out a little bit over here. This is the optic tracts which are wrapping around the anterior surface of the brainstem. And when they do that, they will try to enter posteriorly the lateral geniculate body. Here you can make out the lateral geniculate body over here. This is the medial geniculate body over here, next to the brainstem. Same thing on T2-weighted imaging. T2-weighted imaging is quite easy to pick up the optic nerve because of the CSF space which surrounds it. So a few things you might want to notice when it comes to optic nerve imaging is, okay, always look for a tortuous nerve. Is the optic nerve tortuous? And always look for a dilated optic nerve sheath. These two things indicate that the pressure inside the brain is a little bit higher than it should be. Okay, so this is the orbital segment. This is the cisternal segment. And as you come more posteriorly on T2-weighted imaging, you can see the chiasm and the optic tract. Okay, so to visualize nerves, T2 is the best sequence that you have as compared to T1. T2 is, especially hyper T2 sequences like Cis3D or Fiesta, will be able to pick up cranial nerves better than T1 sequences will be able to. Okay, you can even take sagittal imaging along the entire length of the optic pathway. So you can see here, this is a sagittal image which shows the entire length of the optic nerve, the orbital segment, the canalicular segment, the cisternal segment, over here. This is the chiasm. Okay, so now coming to the oculomotor nerve, as we know, it arises from the interpedicular cistern over here at the level of the midbrain, and when it runs anteriorly, lateral to the pecom in most cases, and medial to the uncus, and enters the cavernous sinus. So here you can see it arising just at the midbrain over here, and then it runs anteriorly next to the uncus, and then it is going to enter into the cavernous sinus over here. Okay, so you can tilt the axial plane and get the entire length of the cranial nerve as well. Since it is tilted, this is most likely the pecom. You can even tilt the coronal plane a little bit, so you can visualize the entire structure of the third nerve along with the PCA and the SCA running above and below it. So this is the basilar bifurcation, the PCA running above the third nerve, and the SCA running below the third nerve lying in between. Okay, so coronal images, if you come a little bit more anteriorly, here you can see the third nerve entering into the cavernous sinus. Again, you can reformat the sagittal images also to pick up the entire length of the third nerve, exiting from the midbrain and entering into the cavernous sinus. Above will be the PCA and below will be the SCA. Okay, so we can pick up the trochlear nerve also. Remember that the trochlear nerve arises from the dorsal surface of the midbrain. So here, this is the dorsal surface. Just at the level of the inferior colliculus, so the fourth cranial nerve will arise. And then it will wrap around just below the tentorial edge. So as you can see, this is the fourth nerve trying to run and enter below the tentorial edge, mainly over here. Okay, so another very important nerve that we need to identify on imaging is the trigeminal nerve. So the trigeminal nerve over here, we had already discussed in the previous lecture, but again, just a few points of repetition. Always first look for the pons. Okay, look for this bridge. You've got the pons over here. Once you know you're at the pontine level, now you can start looking for the Meckel's cave. So this is the Meckel's cave lying right at the posterior edge of the cavernous sinus over here, and medial, the temporal lobe over here. This is the Meckel's cave, and the structure running between the pons and the Meckel's cave will be a fifth nerve. So you can make it out on both sides. You can perform sagittal reformatting in a way that you can see the entire length of the fifth also. This is very useful for trigeminal neuralgia. We can pick out if there's any different vessels which are actually impinging on the fifth nerve throughout its course. This is the same nerve on T1 weighted imaging. Okay, the same thing on coronal image as well. This is the fifth nerve just exiting from the root entry zone, and here it is entering the porus of the trigeminal nerve over here. Okay, so 6, 7, 8 can be, so 6, 7, 8 can be mirrored together usually, especially 7 and 8 has to be mirrored together. So again, we look for the level of the pons over here. This is the pons, the bridge. And just below the trigeminal nerve, you're going to encounter the 7th and the 8th nerve. So 7th and 8th, a little bit more laterally, for example, a little bit more superiorly and medially, you'll have the trigeminal nerve running like this. Okay, and a little bit more laterally and inferiorly, you have the 7th and the 8th exiting and entering the internal acoustic canal over here. A lot medially, a structure sometimes you can pick out on cis imaging would be the 6th nerve or the abducens running lateral to the basilar over here. This loop-like structure here is the ICA, or the anterior inferior cerebellar artery. Sometimes you can even see the 6th nerve entering the Doralus canal. So if you look a little bit more inferior to the Meckel's cave, the point at which the 5th nerve enters the Meckel's cave, a little bit more medial to it and a little bit more inferior, you're going to encounter the Doralus canal. And if you have thin enough cuts, you might be able to see the 6th nerve entering the Doralus canal. You can also sagittal reformat the images and see the entire length of the 6th nerve. So this is the exit from the pontomedullary junction. and entering into Doradus canal over here. You could also see the 7th and the 8th complex at the level of the IAC by getting a sagittal oblique cut through the level of the IAC. Okay. So as you can see over here, this oblique cut is allowing us to visualize the structures of the internal acoustic canal. This is anterior, this is posterior, this is superior, and this is inferior. So as you can see, anteriorly we have 7th nerve and the cochlear nerve. Posteriorly we have the superior part of the vestibular nerve and the inferior part of the vestibular nerve. Same thing a little bit more anteriorly. You have the 7th anteriorly. You have the cochlear nerve anteriorly, and then the superior and the inferior components of the vestibular nerve posteriorly. This is going to enter the cochlea, and these are going to supply the semicircular canals over here. Okay, so you can also visualize the glossopharyngeal nerve at times. This is the glossopharyngeal nerve exiting just below the pontomedullary junction and entering into the jugular foramen. These are 9 and 10 together, 7 and 8 together. Okay, so again, to be sure, sometimes you can get easily confused. Okay, that which nerve are you actually looking at? First thing always is to look at what structure of the brainstem exists at that level. If you're seeing the medulla, and this is very obvious in the medulla, okay, you will not get 5, 6, 7, and 8. Okay, so at the level of the medulla, whatever nerve is there is usually going to be 9 and 10. So you can see here 9 and 10 exiting from the medulla and entering into the jugular foramen over here. If you're at the level of the pons, that's when you should consider 7 and 8. Okay, so this is cranial nerve 10 or vagus entering the jugular foramen over here. The accessory nerve, on the other hand, is going to arise from the spinal cord, run up, enter the foramen magnum, and then enter the jugular foramen. Okay, so you can make it out on the sagittal imaging that it's coming from below. And this is the hypoglossal nerve. The hypoglossal nerve is always going to be present. It's going to be like a little bit more medially to the 9th and 10th, and it's going to be located at a lower level as compared to 9th and 10 as well. So you can see almost at the end of the medulla, where you can even see the tonsils now on both sides, you're getting the 12th nerve. The 11th nerve is trying to climb up from below, behind the 12th nerve over here. Right. So that is all for today's lectures. We'll cover a few questions and let's see what we're able to pick up. Okay, so can anybody identify this structure? You can leave a message in the chat box. Okay, so this is the nodule. So what is the structure below the nodule? Okay, so between the two tonsils and below the nodule, here we have the ovula. Okay, what is this structure? This is the coronal section of the level of the hippocampal body. You have the hippocampus over here. The parahippocampal guide is here. So what would this structure be? Yeah, so this is the collateral sulcus. Okay, so this is a cut section through the level of the internal acoustic canal that we've discussed quite recently. So we will just try and label what is number 2. Okay, so this entire thing, 3, 4, and 2 are all 8th nerve. The first thing is seventh. Okay, so this is superior, this is inferior, this is anterior, this is posterior. Anterior superiorly, you have the seventh. This is 7. All the other structures 2, 3, and 4 are 8. Okay, so this here is cochlear. 3 and 4 are vestibular. 3 is vestibular superior division, and 4 is vestibular inferior division. Okay, now what is this? This is the third nerve here. This is the ICA. This is the infundibulum. This is the dorsum celum. Yeah. So this is the mesencephalic leaflet of the dolichous membrane. Okay. Now what is this? The superior seminal lobule of the cerebellum. This is the inferior seminal lobule of the cerebellum. Okay, so between the two seminal lobules and the most obvious fissure of the cerebellum is the horizontal fissure. This is the horizontal. Okay, so that is all for today's lecture. Thank you so much for attending. If you have any queries, you can leave them in the chat box.